Hello and welcome to this King's Fund online event. My name's Jake Beech. I'm a researcher here at the King's Fund and I'll be chairing the discussions you'll be hearing today. Today's online event is around personalising digital tools for people with learning disabilities. We'll be looking at some of the challenges but also some of the solutions and opportunities that this can lead to. Today I'm joined by Lindsay Courtney, Strategic Lead for Service Design and Practice at Home Group, Glenda Cook, Professor of Gerontological Nursing at Northumbria University, and Sean Duggan, Chief Executive of the Mental Health Network at NHS Confederation. And today's event is in fact sponsored by Home Group. So the session will be recorded ahead of time. As we're recording this, we have attempted to collect a sort of set of questions via Slido, which we've sort of synthesized and pulled together kind of the general themes of to be able to present to our panelists. We're also running this event, of course, with some live audience participation, and we'd like you to submit additional questions via Slido. The panelists will be on Slido to answer them during the event. You should also see a box next to the video, which is where you can submit your questions. And you'll also see throughout this event a series of poll questions and word clouds that, again, you can participate in. These will flash up at various points, and you'll again be able to engage with them through the box on the right-hand side of your screen. If you want to engage with the event outside of Slido questions, we encourage you to tweet on Twitter using the hashtag KFOnline. We can also recommend that the audience yourselves look at the resource tab, which can again be found on the right-hand side of the video. I can now introduce a video which was filmed by service users themselves up at Home Group, talking about their experience of using technology in their own lives. So without further ado, let's hear from the service users.
So we travelled up to Gateshead in January to the NMC house and we spent a day there. We used Alexa and we used video to sequence events of making food, etc. We took 4 customers with us on that trip. So we spent the day there. They loved asking Alexa questions and they loved getting the answers to them. That was really exciting for them. So, for instance, we had like a lot of people who asked kind of what the weather is today, and they loved getting the answer to that. We had one customer in particular who was not with us anymore, he's moved on, but he found it really beneficial to ask about food and content and what was in it, and how much salt was in it and how much fat was in it, because he was quite up on that. So he found that really, really useful. John, who's with me now, found it really funny to ask the Hartlepool scores, didn't you? Yeah. And then compare them to the Liverpool scores and all the other football team scores, and then ask who was ranking highest and who was lowest. I think for John, I think he would benefit from it in ways of alarms for medication, because at the moment he manages his own medication, but he sometimes forgets to take it. So I think a prompt from Alexa would be good to remind him to do that.
And the things that they had in the house was obviously Alexa.
Yeah, what else?
TV.
Yeah, what else?
Blinds.
Yeah.
And lights. The stuff that Alexa could do.
So when we spoke to Alexa, John, what did you have to do with your voice?
Talk slow.
Because Alexa couldn't understand you?
No.
So what happened when you spoke slowly?
Done it.
She understood you?
Yeah.
And how did that make you feel when you had to change your voice? Did you get a little bit cross?
Yeah.
Because she couldn't understand you?
Yeah.
And then what happened when she did understand you? Did she answer you?
Yeah.
And how did that make you feel?
Happy.
Happy?
You talk to her, but like slowly, so you could understand. She could understand you. Say you could tell her to turn the TV on, or maybe the light or the blinds. Play music. It was easy to do.
Yeah, I think using technology like that is quite beneficial for them. You know, mainly the videos and things like that interests them more. Asking Alexa questions, the client I'm with at the moment likes to listen to music, so Alexa would probably be used on music mainly for this customer. He's nodding his head in agreement, so
that's a good sign.
It helps with the mood. He enjoys music on a day-to-day basis to keep him on a level mood, so it is quite beneficial, yeah.
think it would make him more independent in terms of he would be able to say, Alexa, tell me how to make spaghetti bolognese, and Alexa would tell him how to do that, along with his pictorial things that he's got as well. I think it could work in dual alongside each other. And I think it would just give him that little bit more of kind of independence in terms of what's the weather like today, what do I have to wear, you know, like all of that kind of stuff that initially would be a prompt from us, but is quite intrusive. So from a machine, it's a little bit more like it's yours, isn't it? And he can kind of have it in his flat, and he can ask it what he wants and when he wants. A lot of our customers find it quite difficult to communicate using speech. Some of them have speech impediments. Some of them have a slower speech. Some of them couldn't quite get the word Alexa, so they struggled with that. So we were trying to say that they need to speak clearly and slowly, but it was still a little bit of a struggle for them. And some of them got quite frustrated because Alexa couldn't understand what they were saying. So it was a little bit of a stumbling block, I think. You know, we might have somebody who really, really likes an Alexa, but somebody who doesn't and needs something else. So it can't just be a blanket approach to assistive technology. I think it needs to be different for each customer. Assistive technology is just it's a massive way forward, and I think we for our customers especially, I think we would be really benefit from it here.
Thank you very much to the service users to making the effort to provide that for us here today, especially given the restrictions and the difficulties faced with COVID-19. So the online event today will be split into a series of sections. In the first section, we will hear from Glenda Cook and Sean Duggan, who'll be talking about some of the policy and evidence base around implementing technologies to support people with learning disabilities. In the session after that, we will hear from Lindsay Courtney, who will be talking about her experience with Home Group and some of the research they've done to find the best ways of supporting people and some of the pitfalls, some of the challenges and ways of overcoming them around technology. Glenda, would you like to introduce yourself?
Oh, hello. Yes, I'm Glenda Cook, Professor of Nursing at Northumbria University. I have particular research interests in service development to optimise quality of life and later life, and in the role of assistive technologies to support independent living and to enable people to reach their aspirations and improve and attain the best quality of life possible. My work in relationship to assistive technologies has been primarily in evaluating implementation and outcomes. Yes, recently I've been working with housing and master planners design tech-enabled flexible housing to support ageing in place, and with Home Group, to more recently to explore the potential contribution of off-the-shelf technologies to support individuals in their own home.
Thank you, Glenda. And Sean, would you like to introduce yourself?
Yes, hello. I'm Sean Duggan. I'm the Chief Executive of the Mental Health Network for the NHS Confederation. And first, I'd like to say a very warm well done to Home Group and the King's Fund for putting this session on. I understand there's been a very big demand, so it's obviously a topic of great value at the moment. I have got a great passion for this particular area, both on personalisation and co-production, to ensure that service users are right at the heart and centre of everything that we do, and also the innovation around digital health and care systems. One thing that's come from COVID, of course, is a focus and an increase in use of this particular area. So it's very topical and very timely for us to discuss this. My particular interest is to ensure that we influence government to make sure that learning disabilities and digital interventions, digital solutions are very much a priority and continues to be a priority, so that investment will flow into this really important area, because we know in the past, historically, investment has not really reached the levels that it should have done within mental health and learning disabilities. And also it's to support and help corporate boards to ensure that this particular issue is a focus of their discussions and a priority within the corporate organisations. And then finally, my interest here is that as we move to what we call a systems structure for health and social care in the community with integrated care systems, primary care networks, this needs to be on their radars, and I will do all I can with my colleagues to ensure that it is.
So one of the questions, again, we have through from Slido, a synthesis of the key points that people wanted to raise. What are the key types of tech solutions that work best for people, and how do you tailor them to the person? Glenda, can we come to you first for this?
Yeah, this is a really exciting time. We have a proliferation in terms of tech solutions. Historically, we have telecare, use of telehealth solutions, but now that we've got a range of off-the-shelf products, services that are extremely affordable, that people want, because it's very much normalizing the experience that people want to be able to automate their homes, want to use the prompts and reminders of the virtual assistants, such as Alexa or Google Home. So it's a great opportunity, but so some of the challenges are often we go to, very quickly to the whizzy, great new, sometimes very expensive kit, rather than actually just using some of those products and services that sort of not complex, very straightforward, easy to use, and we could, such as LED lighting, sort of to brighten or illuminate a home in the night, when someone's wanting to go to the toilet, and that avoids falls or trips at night time, so it optimizes safety. So I think we need just go for the bright new technology. We actually look at that full range of technology.
So it sounds, Glenda, to me like it's the simplicity, rather than sort of aiming for sort of, these really complicated devices. It's really about finding the tech solutions, as you say, off the shelf, to really help people in sort of the here and now, rather than overcomplicating it, really leading into kind of the things that we have available. That's really interesting. Sean, I wonder if there's anything you wanted to bring in there yourself.
Well, yes, it's just that we've got such a really good opportunity, I think, for ensuring we embrace all the innovation that's coming our way now for digital solutions. And with this client group, it is so, we're really there for all sorts of opportunities, and we should embrace that. We've got to be careful of a couple of factors, and one is about inclusivity. Not everybody has the infrastructure and the right digital devices. Not everybody has the right level of budget, family budgets, or budgets from elsewhere to be able to make sure that they've got all the right digital infrastructure to be able to use these services. That's for service users and their carers and families. So with one aspect, what COVID's done is it's really encouraged us and pushed us towards some digital solutions, but also we're going to have an economic downturn from COVID, long COVID, we're now starting to talk about, and that's just going to make a lot more difficulties for budgets. That's investment centrally and at local areas, and for personal budgets as well. So we've got to be careful of that. I do think there's a role for commissioners. There's a role for regulators. I'm very excited about all the solutions. It's absolutely fantastic. We've got to make sure that they work. We've got to make sure that they've got evidence attached to them, and it does improve the lives of service users and their carers. And that's where commissioners and regulators come into play. So open communication with those folks is really important too.
I think that's a really interesting point, and the point you raise about accessibility, both in general, in general particularly, is very interesting. I suppose I want to sort of bring it back to the accessibility down to the individual. And Glenda, I'd probably want to bring you in on this as well. How do you make these sort of off-the-shelf items, off-the-shelf technologies, the simplistic, widely available technology, work for the person? How do you tailor it? How do you work with the person to make it meet their needs?
Yeah, well, the most fundamental issue is identifying or assessing what the individual requirements are of the individual themselves, the end user, and their family or supporters, as well as the professional supporters. And so that it's identifying from that premise what technology works for that individual and what circumstance and what they really want to get out of it. For many of the off-the-shelf products, it's not so straightforward for individuals. So some of the individuals we've been working with over the last year would have a desire to use an Alexa, for example, But one of the young people that we were working with couldn't pronounce the word Alexa. So he would articulate it as Aletha. So that voice activation command was not available to him. And that was extremely frustrating. So not only is it finding out what people want, but it's also finding out, can they use the technology? So in that particular circumstance, what we were able to do is work with the existing engineer a solution. So we created a solution called Introvox, and essentially it's a Raspberry Pi, so a small computer, fitted with a range of sensors and a range of commands that would overcome the necessity for the end user or the customer to actually use the command Alexa. And home automation was possible. So we'd have light sensors attached to this small computer, and the small computer would then activate the Alexa by sending a message, which could be silently, or it could be a synthesized computer voice. Now, the service users that we were working with said that actually, if you have lights going on in the house, or if you have the blinds, closing, it could be, they described as scary or spooky, and they wanted to hear what was happening in their environment. So they wanted a message such as, so Alexa, please close the blinds, or turn the lights on, or turn the music on, whatever they wanted the computer systems or the technology to do for them, if they couldn't do it for themselves. There's other situations where individuals are unable to use the technology. So, for example, people with memory problems. So speech problems, one particular challenge. Memory problems, so you can't remember how to use the technology or remember what the technology can do for people. So there is the opportunity to personalize these technologies. What we're also sort of advised by the people that we're working with is actually synthesized computer voices could be quite sort of complex to understand. They could be quite frightening for people. So, again, with using the same back engineering process and the solution that we came up with, which we call Introvox, if we could actually have the individual themselves recording their voice, given the command, to the technology to create or do things within their home environment, or it could be a family member, a carer. So it's about that familiarity, and by using a familiar voice, that personalizes the technology.
Fantastic, thank you, Glenda. And this next question that we've sort of had come through from Slido, another synthesis question, really follows on from that. And it's about the process you use to get to those decisions, around getting to the point where, you make those choices around a person's voice, whose voice comes through the speakers. And I think the essence of it is, what are the best approaches that have been found, that you have found, to working with users, carers, families, care professionals, all of the people around the person, to ensure this kind of effective personalization and co-production. And I know co-production has different definitions to different people, but if you could sort of take that and give us your views, and then I'll come to Sean afterwards for his perspective.
Yeah, well, so co-productions are absolutely important. In our project over the last 12 months, what we started with was, we called them communities of practice, and these were groups where people with learning disabilities, autism spectrum conditions, met with family members, service users, practitioners, tech designers, as well were in our group, and service commissioners. And what we wanted to do was walk them through a day in their life to see what what technology they wanted, what were their needs, what were their problems. But equally important, what were their aspirations? Because it's not just about problematizing, using tech, as largely in the past. That's what we've done, is we've focused on the problems and use tech solutions to address problems. What these young people were telling us is actually, what they wanted was to have technology that would improve their lives and so ensure that their lives were the same as many other young people that they know. So within these groups, yes, we had a range of workshops where we demonstrated technologies. We listened to what they wanted. We listened to some of the challenges, and we allowed them, create circumstances where they could play with the technology. So we had Alexas, and people wanted to know the football results, for example. And and that's where we identified there was a lot of speech problems, memory problems about listening and remembering that you have to phrase the question in a particular way to achieve the result or the information that you wanted. And then we used a range of solutions, again, for to see, well, what do they think was the best solution that enabled them to use the products and services. So just to give you another example, we know that on the market that we have smart buttons, and smart buttons can perform a range of functions. So the smart buttons that we used required one click, and that could enable a device or an app to start. So what these young people were saying is that they didn't want carers to always do things for them. So, for example, they would want to bake their own cakes or make a cheese sandwich, but often they couldn't remember how to do that. So in that skills development, what we came up with was using a smart button that would activate a video either on their own phone or on a tablet, where they could watch that using their own in their own kitchen. So we would start with one click of the button. If they wanted to make a sandwich, either they or their carer could prepare the sandwich. So getting the bread, the cheese out of their refrigerator, showing them how to prepare the sandwich and cut it up. And the young people that we worked with in a couple of workshops, indeed they ate all the sandwiches. They wanted to do it time and time again. But we were also able to identify that these individuals could use the stop-start function. And what I mean by that, you would click the button, but the video would run. Could they stop it while they got out the breadboard and they got out the knife and everything to make the sandwich, and start it again? So they followed the next instruction, and absolutely they could do that. They really like the idea of seeing themselves in some situations. And again, this goes back to the point about personalising. Some people wanted to watch someone else prepare a sandwich in their own kitchen, but some of them wanted to see themselves doing that and achieving that outcome. Yeah. So what's quite good in this particular illustration or this particular application that we were able to develop is that we could work, or if it was a carer, they could ask the individual what they wanted, check that that they could actually manage it, slow down the speed of delivery. They could stop, start, work at their own pace, and the sense of achievement that they could make their own lunch, or if you used it to do their own washing, they told us that they really like the idea that they could do things for themselves.
Sean, do you want to sort of pick up on some of the points Glenda's made?
Well, I just think that it's very heartening to see Glenda's passion come through.
Absolutely.
No wonder this project is working very well with leaders like Glenda. And I also think that if you wanted to look for an example of personalisation and co-production, look no further than what we've just heard from Glenda. And one thing I ought to say is that in this area around learning disabilities, it's also true in the mental health sector. The rest of the health and social care sector could learn a lot of lessons about personalisation and co-production from people like Glenda and others and Home Group. We are doing it quite well. We've got a way to go. There's always improvements to be made, but when you talk to colleagues within the acute sector running hospitals and running primary care, they look at us and to look at how they can do co-production and putting services right at the heart better. They look to us, which is great, and we should say that. I think the other thing I would say, more of a wider issue, is that what we're hearing today is a good example of where you can bring the independent sector, where you can bring the not-for-profit sector, like an organisation like Home Group, and academia, the universities, bring them together and work very hard on pilots that work quite well. And actually, that's really important going forward, because we're going to need 4 good learning disability services right across the country. We're going to need the not-for-profit to work better with the statutory organisations and also the independent sector. So it's always good to hear an example of that. And one final thing, what Glenda and Home Group are talking about is innovation. This is new ideas coming through, testing them out, making sure that they work, being absolutely convinced that the end user and their families get benefits from it. That innovation requires research and development. It requires investment in research and development, both at government level, and we know that in the area of learning disabilities and mental health, that's lacking. It is substandard when you consider the amount of work, amount of investment we put into research and development in cancer, heart diseases, and various other physical areas. We need to up our game with this so we can scale up the sort of thing that we're talking about this morning. So I think it really is about, you know, what we put into research and development, but all praise to organisations that just get on and do it. By building up relationships, getting to trust one another, and then coming up with a program like this.
So that's really good to hear from both of you. So I think one of the things our audience might want to hear, as well as the benefits and ways of implementing this. So what are some of the difficulties and some of the challenges that are faced when implementing this technology to support people? How do you work with the person, the family, and their carers, especially to overcome these where they do present themselves? I think I'll come to you, Glenda, for that one, if that's okay.
Yeah, so there's a huge range of challenges. Yes, I would probably say one of the first ones is knowing what tech exists and what the tech offer could be. Yes, we spent an enormous amount of time looking at all the apps that are available, wading our way through those, looking at different products that are just sort of in our supermarket shelves, that we can purchase or Amazon or whatever, as well as the traditional telecare and telehealth offers. In our community of practice, what came up back time and time again is that people just did not know what existed. So we were finding it out, demonstrating, showcasing, getting feedback from people. But people were quite amazed by that. So I'll give you one example that was quite striking for me. Is that we had one of our PhD students demonstrating a glucose monitoring, which basically is a telehealth device. It's a medical device. It's a small disc that's inserted into the upper arm or someone's skin that can constantly provide glucose monitoring. So in the population of people with learning disabilities, there's a high level of diabetes. We know that. And one service provider, you had someone who was very, very unstable, and this person needed their use of their glucose monitored basically on a 2-hour basis, and that was throughout the night at some points. It's a very ill person, and that meant finger pricking, which is very distressing for someone. So that required a number of staff involved, with this individual to do the finger pricking, to get the results, and provide the right nutrients to ensure that they were stable and the right medical treatment. With the use of that medical device, that would be far more comfortable for the individual. A service provider said it would be cost effective, for the organisation. And it would have positive outcomes, whichever way you looked at that situation. But the service provider did not know that device existed. Someone else in the room in that community of practice said, well, actually, it can't be funded through prescribing budgets. But so someone else was able to advise how actually that could be achieved. So I think that sort of highlights lack of knowledge and the need to know more. So that's one particular challenge. Another challenge is looking at our tech market. So our tech market, basically is an industry, where it's an open market. So for each tech solution, you have a number of apps. If someone wants to use 5 tech devices, for example, with 5 apps, that becomes too complex, too confusing, and that sort of undermines sort of the benefit that can be gained from all those solutions. So again, having some open source access to the data, because most tech providers keep the data, and service providers or sort of healthcare professionals can't access that data. We want to be able to access the data so we can identify people's norms, look at the outcomes, and sort of ensure that there's some benefit achieved by use of the tech solutions. I've already given an example where often people can't use the technology, but it is possible to back engineer solutions where individuals can gain the benefit. But that needs computer scientists and engineers to come alongside healthcare professionals. So I think there is a need as we move forward to sort of have a multidisciplinary approach to this particular topic to ensure that we get the best solutions that work for individuals and service providers and that can be commissioned effectively.
That's really interesting, Glenda. That's absolutely fantastic. So it sounds like it's a combination of accessibility, knowledge, and bringing in the right people to be able to tailor those. The computer scientists, people who traditionally sit outside of health and care, at least in many people's minds. I'll follow up with a slightly different question now for you, Sean, if that's okay. What do organisations implementing this technology to support people have to get right? From an organisational perspective, how do they get safeguarding right, governance, data protection, and how do they get the right values to implement this effectively?
Yeah, thanks, Jake. Yeah, I think the first thing I'd say is that the top of the organisation, whatever organisation it might be, that's local authority, a housing group, a charity, or an NHS trust, the top of the organisation needs to be bought in. There needs commitment. It's always the way that there are problems if we don't get that. You do see some fantastic inspirational ideas where staff feel empowered to get on and do something, but unless the top of the organisation does have the full commitment, then further on down the implementation programme there can be problems. So that's the first thing to say. And the second thing is, it's good, you must have a vision. You must have a narrative about what this digital improvement should do for service users and their families. What are going to be the benefits? Why are we doing it? The really basic questions that people need to be reminded of all throughout the programme, because staff will be asked, service users and carers will be asking, well, what's this all about? How will I get benefits? So we need to keep repeating why we're doing it in the first place. I think it's fascinating to see a whole raft of voluntary not-for-profit organisations working with NHS organisations, local authorities now in providing some solutions. And when you're working with clinical partners, organisations need to think about clinical governance. And what I mean by that, it relates to safeguarding, but it is about what safety checks are in place to ensure that what we're doing as a pilot or a programme is effective, it's safe, all those things that are absolutely fundamentally important. So the organisations need to have a clinical governance policy in place, a clinical governance structure in place, that safeguarding is talked about and examined right at the beginning and throughout. And I'm sure Glenda and Home Group are doing that very well. The other thing that which I said at the beginning that can block and can hinder implementation is the finances and the investment. Organisations need to ensure that there is enough investment to implement this programme properly. I always think it's quite difficult for organisations, but I do think when you've got a digital idea, a digital solution, try to think about the economic evaluation of that at the beginning. You'll obviously be looking at effective evaluation, whether it's good on quality, but will it save money? A lot of these digital solutions will save money. They certainly won't cost any more. So it's vitally important to know that for the local areas. Commissioners will be asking that all the time. Central bodies will be asking that all the time. And the top of the organisations, corporate boards will be asking that. Will this cost us more money? If it does, and it's worth doing, we'll of course put that money aside. But if it actually saves money, then, and a lot of these do, then bring that to the fore, because it will help with the implementation. And I think finally, bringing your staff with you, it's a whole area of workforce. And I think we've got to say that during COVID and during this particularly difficult time, staff are under so much pressure at the moment, but it is right to implement these new solutions, but look after your staff. The mental health well-being, physical well-being of your staff, it is the most important asset of any organisation. And if you want it to work, then take your staff with you and look after them. So thanks, Jake.
Thank you, Sean. A very important set of very powerful messages, I think. So here's a question that's come through from Slido, and it's a synthesis of a number of different questions. And I think the essence is, how do we get accessibility and personalisation embedded meaningfully across the entire health and care system? I think, first of all, I think we'll come to Sean for that one. Sean, could you run with that question?
Yeah, I think the first thing I'd say is we need to continue with the need to get learning disabilities and learning disabilities health, social care and treatment very much at the priority for government. There's been some improvement in that over the last couple of years. My belief now is that alongside mental health, that there is much more of an awareness and much more of a will to really treat this area as a priority. Because unless we do that, we won't get the investment, we won't get the attention for workforce and all the other things that really matter. So I think we've just got to keep continuing with our influence and our pressure on government. And then the arm's length bodies, obviously that's Public Health England and NHS England, NHS Improvement and local authorities. So you've got to do it sort of from a central point of view as well. But to get it embedded right across the system, I think there's an advantage. I think we've got an opportunity now with the introduction of STPs and integrated care systems. These are organisations that bring in local authority, bring in health and social care together and local communities to ensure that the health of the population and the care of the population is dealt with properly and invested in properly. And I suspect that although learning disabilities will be on their radar, the intricacies of what we're talking about this morning with personalisation and digital improvements probably isn't. So we'll have to do a bit more with that. And the other new part of the system is primary care networks. I think GPs and their colleagues within primary care networks, and there's going to be about 1,300 of them across the country, they see this as an important area. And I think if we can get them to influence their colleagues at the local area, that will help enormously. So I think, and then of course you've got the professional groups, you know, social care and professional groups within healthcare, nursing, to just name but one, and occupational therapy. I think they can help influence and get it a priority. But the issue I think with learning disabilities is workforce is a real challenge. We'll probably come on to that, but we've got to do a lot more to ensure that we improve the workforce and retain the workforce. And wonderful organisations like Home Group, that are, you know, traditionally a housing association, they're in on this and they can help us enormously.
Thank you very much, Sean. Glenda, do you want to come in with any observations on that?
Yeah, absolutely, Sean. Yes, I would totally agree with what you've just stated, that that there's a key role as we move forward in terms of policy taking this forward, addressing some of the challenges in the system, addressing some of the difficulties that people have, in using technology. Yes, so it's a very market-driven environment, and often that poses problems for like the end users, individuals, where you're experiencing a range of difficulties and problems, and for organizations to implement tech care solutions. So I really feel that there is an absolute key role for policy makers to address this issue, and across society, those living with learning disabilities, autism spectrum conditions and their families will benefit.
Glenda, as we come close to time, is there any sort of final reflections from you in sort of the last minute or so that you want to sort of bring about? I think Sean's touched upon a variety of really important factors. Is there anything from you, Glenda, just for the final minute or so, that you really want to hammer home? Any key messages?
Yeah, it certainly is. I think it's an exciting time. Exciting time for healthcare, social care, amidst some substantial societal challenges as we're in the midst of a pandemic. I think the role of technology should not be underestimated, but I also think it's highly important to be working with end users and not for creating technology just for end users, because often that ends up in sort of not too good an outcome. And I think another key issue is for actually people to work together, the commissioners, service providers, carers, end users, academics and researchers working in this field is absolutely important. So we actually get the best of what we can with what currently exists or could exist in the future.
Fantastic. Well, thank you to you both. Thank you, Sean, and thank you, Glenda, for joining us here today.
Thank you.
So in that previous section, we heard from Glenda Cook from Northumbria University and Sean Duggan from the Mental Health Network at NHS Confederation. In this next section, we sit down with Lindsay Courtney, who is Strategic Lead for Service Design and Practice at Home Group, to hear about the research they've been doing with their service users around the use of technology. Lindsay, thank you for joining us.
Hello.
Perfect. So as I understand it, with Northumbria University, you've been doing a fair amount of research into how best to support people with learning disabilities through the use of technology. Obviously, Glenda and Sean have talked us through the policy aspects of some of that, as well as some of the evidence. What I'd like to sort of hear from you is sort of your experience on the ground of that stuff and what the research is telling us. So I think perhaps the best place to dive in is with a similar question to one we put to the previous two, and that is, what are the types of tech solutions that work best, and how do you tailor them to the person?
Okay, I think that's a really interesting question. I think it's partly why we went on to do this research. So what we found in Home Group was we were trying to find technical solutions that supported our customers, particularly our customers with learning disability, to be more independent and more enabled in their own environments. And actually, we very quickly got drawn into an awful lot of technology that's out there, that's shiny, it's creative. But actually, sometimes it's too technical. And actually, what we wanted to do was explore what are the range of solutions? And I'm sure Glenda mentioned, but sometimes the simple solutions are the most powerful for our customers. I think the other thing for me as an occupational therapist, I'm very aware of, at time we put technology in thinking it will enable people, but actually it can have the opposite effect. So I've seen great examples where people can get text messages, can connect with their families via television, but actually if we're encouraging people to go out, that's a disincentive for people to feel that they want to leave their home and do things, because actually there's an incentive to sit in front of that television hoping that a text will come in. So I think from a Home Group's point of view, we really wanted to get under the skin of what do our customers really want from technology and to wrap it around their individual needs.
So is there a particular example that you can use of how you've sort of wrapped that technology around that person and, really enabled them with the technology and worked with them to make sure it does the enabling rather than that, as you say, the disabling?
Yeah, we had one customer who was really keen to be out and about in his community, but he was aware that at times he got a bit lost in that community and didn't know where he was and was very reliant on support staff going with him. But he was a younger man and he wanted that independence. So actually, he worked with us to have a tracker put in his shoe. That was something he chose, because we've got to be careful of safeguarding and all of those issues when we get into that almost perceived invasive technology. But actually, that gave him the confidence to know that his support staff would know where he was, and should he get lost, they'd be able to go and find him and bring him back. And actually what we found was that he gained in confidence, he didn't become lost, and actually that really opened a huge window of opportunity for him to re-engage with his with outdoor space and with being able to do what he wanted to do.
Absolutely. It's really interesting you sort of mentioned the word safeguard in there, because I imagine some people, quite a lot of people, families, carers, professionals, the person themselves in many cases, might have sort of questions around safeguarding, around privacy, for example. I was wondering how Home Group and what your research told you, how you sort of work with the person to ensure that wasn't the case, to ensure that their privacy needs were met, to ensure that they were safeguarded effectively.
I mean, I think one of the things that we really do try and do, and it's part of our life model, which is our support practice model, which is living independently, feeling enabled. It is very much about working with all of our customers on an individual basis to understand what their aspirations are. And if technology can support them within those aspirations, it's working with them to understand what the pros and cons are and to talk through with them how that might help them, but what some of those disadvantages might be. And I think where we can, we have to give people choice as to whether they wish to engage with technology or not. And as well, we've got to work with families. People have to feel comfortable. Often technology is going into people's home environments And I think we'd all feel the same, that can be intrusive. But I think one of the really interesting things that came out of our research when we worked with the communities of practice, often as professionals, and I'm an occupational therapist, we make assumptions that people don't want to engage with technology because they do feel it's intrusive, because the whole issue of data collection. Actually, we got strong feedback from people to say technology is part of everyday life now. We all have technology in our homes. A lot of people have Alexa or Google Home. And actually, people were quite embracing of looking at that technology. And so I think we've got to ask people, and we've got to work with families to find what fits for them.
So that's really interesting, actually. And I think one of the things you brought out there is of course, working with families, working with the service user. I was just wondering, what is your approach to that? How do you go about at Home Group making that kind of co-production? And I know, again, I mentioned it in the previous one, co-production has as many meanings as there are people. But I was wondering what your particular approach was, how you actually did that on the ground delivery of working with the person in this realm of technology, which is a bit of a new frontier.
I think what's really important for us is, as I've said, our living independently, feeling enabled life support model. And integral to that is important to people and important for people. So what are those things that are important to our individual customers, which is about their personal aspirations, how they want to live their life, as well as what's important for, and that's the bit about safeguarding and protection. So I think we always work with individuals in that way. I think what we've got to do is not see technology as a side stream, as something separate. It has to be embedded in people's personal care plans, how they want to live their life. But one of the things we're moving on to is kind of to look at personalizing technology in terms of people's individual day. So where does it have the pertinent interface with what people want to do as part of a normal day? So we've got to normalize technology as well.
Fantastic. Although, and I'm sure many people watching this will appreciate, we live in far from normal times,
Oh, yeah.
as you might as you might have sort of faced in your work. So I suppose one of the questions I'd want to put to you is how the COVID-19 pandemic has affected your work at Home Group, and how some of the use of technology, as we've seen across society, has kind of enabled people to do things and work in ways that they haven't been able to work before, and allowed them to continue doing things perhaps that they couldn't otherwise in the pandemic. I was wondering how you might have used technology to enable people during COVID-19, when there are very particular issues facing all kinds of groups of people, including your client group.
I'm not sure that we're at the point where we've been able to use that technology at this point, because we're still on that journey of exploring. But what I can say is what we in retrospect have had feedback is that if some of those technology that we've looked at, such as that videoing, such as people being able to connect with family and friends through this time, would have actually improve people's qualities of life. I think one of the things we were coming on to at the latter half of the research is how do we wrap everything from the video that Glenda talked about, Introvox, that personalization of prompts and messages, into almost the concept of a personalized diary. So actually, what that diary might do is very interactive. You wake up in the morning, the question you might be asked, is this a good day for you or a bad day for you? If it's a bad day for you, it might say, have you thought about going for a walk, or have you thought about doing some mindfulness? And actually, what that technology does is put the control back to the individual to start to move forward in what's those positive things that gets them to a better place without the reliance of, say, a phone call off a support member of staff. So it actually gives the control back. And I think we're at the cusp of, if we had been 6 months down the line, we might have had more technology that would support people. But I think we can see the benefits that it would have had during COVID-19. I think it's really given us a new incentive in Home Group to really push that technology strategy forward for our customers.
And I think some of what we've heard through, for example, from Slido, and from what I've heard sort of in my work at the King's Fund, is that a lot of people, and I'm sure it runs the full spectrum of carers, family, service users themselves, they are very keen to see this technology not be a replacement for other elements of care, and I suppose nor would we want it to. So I was wondering how you sort of straddled that line, you know, either your research or your practice going forwards, how you're making sure that, you know, these technologies you're implementing aren't a replacement for other types of care. And I know that sort of touches upon some of the other things we've talked around about patient choice, about sort of co-production, but I was wondering what your thoughts were around ensuring that these things don't replace, but they enhance and support.
And I think in many respects, you've almost answered that. For me, it is about that co-production, how we work with the individual and their families to embed technology as part of that care. I think it's about the values that we in Home Group and our care and support staff demonstrate, that actually technology should never replace that personal relationship we build up with customers. And actually it's that really strong personal relationship and understanding of our customers' needs that allows us to get the technology right for them, and not something that we just bolt on. The last thing we should do is just purchase technology and put it in and assuming it's a panacea and the solution. It's not. It will only be right because it's built on the relationship we have with our customers and knowing them.
So thank you very much, Lindsay, for joining me today. A really interesting discussion, and thank you so much for sort of bringing the kind of the Home Group perspective and your sort of findings on the ground. Really appreciate it. Thank you.
No problem. Thank you.
So thank you to all our panelists today, and thank you to Home Group for sponsoring this event. I hope you enjoyed this online event from the King's Fund.